So about radiation therapy, also one of the choice. Chemotherapy, also one of the choice of hormone and target therapy. So up to the point, if someone need to have go through this, usually the doctor will sit down and discuss all the options and give you some education because we have time limit. So Patricia will talk about a little bit living a breast cancer is a survival, and she will talk about a little bit more, and Vivian will talk about cover a little bit regarding the nursing perspective, and then I just go pass on this slide for the future and for the breast cancer research. They're trying to find out and how to prevent it and detect the cancer, and also how to improve the quality of life. So this is the major focus. They're trying to find out what's the cause of breast cancer and the treatment, and for metastatic breast cancer, reducing the breast cancer risk, and also manager for the this type of carcinoma cancer, and trying to develop some tests can find out before, and also develop some new image and to detect the cancer, and also including the treatment and support care. So Vivian is to go over.
Okay. I mentioned I'm going to go over some stuff that elaborate a little more. All right. So she mentioned about different tests when you go to get your mammogram. The most recently, you will hear people say, I have dense breasts. And then, you would say, what is dense breast? You would say breast density is when your breast tissue is made up of fibrous tissue, glandular tissue, and it's just a little, it's considered to be dense and fibrous. So when they take a picture of it, it's not very clear. So now, in 2018, they came out, well, a little before that, 3D. So when you go now to get a mammogram, they do it in 3D. What this does, it's more definitive than the regular routine mammo, because the breast tissue is viewed in slices, so they can see the cells, like a tumor more specifically. So now, when women, we don't assess our breasts monthly. It's important that women and men do self-breast exam. You can do it lying down, you can do it in the shower. I place outside some of these cards. These are very old, but they're still useful. You can put it in your shower. So usually, if you're standing up and you want to do your self-breast exam, you will start. You can start either with your left hand or your right hand. I will start. You put your left hand behind your back. You're in the shower, okay? And then you take your hands, you start from the nipple. You kind of, in a circular motion, you press, and you continue pressing until you get to the outer part, all the way up. You go under your armpit. You feel under your armpit because you have those lymph nodes there. And usually, when a woman is diagnosed with cancer, it usually starts at the nipple. Okay? So it's very important that you either lay down or you stand up, and you just, in a circular motion with your 3 fingers, and you just press. And just, close your eyes and just continue in a circular motion, and you go around and around until you get to your axilla, and you palpate that area very well. Then you rotate and do it to the other side. Okay, so if you find a tumor, if you find a lump, you go to your doctor, and the doctor first, he sets up testing. Now, it's very important today, in 2018, anyone diagnosed with any type of cancer, do genetic testing. It's so important because up until 10 years ago, women, especially African American women, would get cancer, and they would treat all women, Asian, Hispanic, African American women, with the same recipe, same drugs. After 3 months, they scanned you, and then they find out, oh, why is the tumor not shrinking? Because the drugs that they are giving to you is inappropriate. It's not specifically to your cancer cells. So there are biomarkers. And these biomarkers, when you're diagnosed, I'm sure you heard about ER positive, ER negative. ER positive is estrogen positive. PR positive is progesterone positive. And then HER2. Okay, what does this mean? Well, the most known biomarkers guide breast cancer treatment. Very important. These estrogen and progesterone hormones, they circulate in your body. They are proteins, regular proteins that send signals to the cells in your body. These hormones can signal to some breast cancer, whether it's ER positive and ER negative. Now, there is one breast cancer that like I said, was only specifically geared to African American up until 10 years ago. In 2007, they found out that Asian, Caucasian women get is called triple negative breast cancer, which is the most aggressive of all breast cancers. And approximately 20% of women gets this aggressive breast cancer. So it's very important that you do genetic testing. Now, of course, last year you heard about, 2 years ago, you heard about Angelina Jolie had BRCA1 and BRCA2 gene mutations. Why are these important? They're very important because most inherited breast cancers are associated with mutation in 2 genes, the BRCA1 and the BRCA2. What are these BRCAs? Well, they are important because they also, they make their changes occurs in the DNA makeup, okay? They provide instructions and leading to cell growth functions. In a person, any person that has a gene, a mistake in the gene, it's like a signal, there's a wrong, there's an error, okay? These 2 types of DNA changes those that are inherited, and that is over time. Inherited DNA changes and are passed down from child to mother, as Kylie said before. So it's very important to get these BRCA gene testing. there is also some testing for people, for women, who already are survivors. There's a lot of them that are out now. The Mama Print test is for women who have survived breast cancer over 10 years. The Mama Stride test is used to predict reoccurrence in early stage of breast cancer. And there's several others that I can tell you. Like if you are 5 years survival, there is the PAM50 test. And that seems to be very current right now. Now, Kayin mentioned also about treatments. Well, you have people, a woman goes, okay, I'll start with the treatment. You come in, you have your treatment. Like I said, it is specifically individualized to your gene makeup. So there is the routine chemotherapy, there's hormonal therapy. Hormonal therapy are usually given to postmenopausal women. And these are for people who have HER2 positive breast cancers. What does it do? It lowers the hormone estrogen in the body. It blocks the estrogen of the breast cancer from growing. Okay? Now, there's two organs in our body. There's one other organ in our body that produces estrogen other than our breast. And then that is the ovaries. So you have to also, if you're diagnosed with breast cancer, it's very important that you have a pap smear, you follow up. Because if you have breast cancer, you can also develop ovarian cancer. Now there's other side effects, but I don't want to scare you, but it's always important. The key thing you should take away from here is to follow up with your doctors. Whatever subtle signs you have, do not avoid getting treatment or having it investigated. Most of this is repetitive. Now, when we talk about survivalship, from the nurse's point of view, women go through treatment, and then the doctor says, oh, you're cured. There's no cancer. It's important to find support because you might not have the symptoms, or your friend might have symptoms, and you can share your knowledge of your experience with your friend. We develop program for survivorship in nursing where we follow these patients because, the patient says, oh my God, I went through all my treatment. Now what do I do? Surveillance. Be monitored constantly. Have your x-rays, your 3 months x-rays, your 6 months x-rays, and anything that you find, any subtle change in your body is important. Now, we also talk about dietary habits. Watch what you eat. Now, I never used to believe about organic food. I do believe in organic now. I still say in the United States, organic is not all as it crack up to be because it's money driven. When I say that, back home, I'm from the island, and back home in your country, everything is grown from the ground. It's healthy. We know what we put on the ground. Even though someone would say it's organic, you don't know really what they're doing because it's money. They're looking for the product. So, but still, green leafy vegetable. Eat your vegetables. If you're going to eat the pork, the chicken, make sure it's lean. Fat, minus fat. Alcohol, like Kayin said, reduce your alcohol intake. And Exercise. Exercise is very important. Yoga. The gym. All those things are important. I won't take up any more time. I'm going to let Pat talk more about survivorship. We will have some, questions and answers, at the end.